Most people believe lowering blood pressure requires stronger medications, higher doses, or lifelong dependency on pills. But what I'm about to explain may completely change how you think about controlling your blood pressure, starting today. There is something you've used since the moment you were born. Something you use every single day without thinking. And yet, when used correctly, it can lower blood pressure within minutes, not hours, not days, minutes. That tool is your breathing. I've spent years working with patients who were told their numbers would only worsen with age. Many were already on 2 or 3 medications, still seeing dangerous spikes during stress, anxiety, or even routine daily activities. What surprised them most was not a new drug or device, but how quickly their blood pressure responded once they learned how to breathe properly. Here's what most people are never told: your breath is directly connected to your nervous system. And your nervous system controls your heart rate, your blood vessels, and your blood pressure. Fast, shallow breathing, especially during stress, signals your body to stay in fight or flight mode. Blood vessels tighten. Heart rate increases. Blood pressure rises. But slow, intentional breathing does the opposite. It activates the calming branch of your nervous system, allowing blood vessels to relax and pressure to drop naturally. This isn't theory. This is physiology. Clinical studies have shown that controlled breathing can lower systolic blood pressure by 10 to 20 points, sometimes within just a few minutes. That's comparable to adding another blood pressure medication, except breathing is free, has no side effects, and puts control back in your hands. And yet, most people never learn this. Why? Because breathing techniques aren't profitable. There's no prescription to write. No product to sell. So they're often overlooked, despite overwhelming scientific support. In this video, I'm going to guide you through 3 specific breathing techniques that I've personally taught to patients struggling with high blood pressure. We'll practice them together, step by step, with precise timing, so you don't have to guess or wonder if you're redoing it correctly. By the end of this video, you'll know which breathing technique works best for daily control, which one helps during stress or anxiety, and which one can quickly calm dangerous blood pressure spikes. You'll also learn when to use each technique and how often to practice for lasting results. This is not about replacing medical care. It's about giving your body the support it was designed to use, naturally and effectively. So before we begin, I want you to do one thing. If you have a blood pressure monitor nearby, take a reading now and write it down. This will be your baseline. We'll come back to it later. Now, let's begin with the first breathing technique, one of the simplest, yet most powerful methods for calming your nervous system and lowering blood pressure quickly. Technique 1. The calming breath that lowers pressure fast. The first breathing technique I want to teach you is one of the most effective ways to quickly calm your nervous system and bring blood pressure down naturally. It's simple, structured, and extremely powerful when done correctly. This technique works by extending the exhale, which sends a clear signal to your body that it's safe to relax. When your exhale is longer than your inhale, your body shifts out of stress mode and into what's called the rest and repair state. Blood vessels relax. Heart rate slows. Blood pressure begins to drop. This technique follows a clear rhythm. You breathe in slowly, you briefly hold the breath, and then you breathe out even more slowly. The long, controlled exhale is the key. I've taught this method to many older adults who experienced sudden blood pressure spikes during stress, emotional moments, or even simple daily frustrations. What's remarkable is how quickly their numbers responded, often within 2 minutes. Let me explain why this works. Your nervous system has 2 main branches. One prepares you for danger. The other promotes calm, digestion, and healing. Slow breathing directly activates the calming branch. As soon as that system turns on, blood vessels widen, resistance drops, and pressure decreases. Now, let's practice this together. Before we begin, sit comfortably. Keep your spine upright but relaxed. Place one hand on your chest and one on your abdomen. When you breathe in, you want the lower hand, the one on your belly, to move more than the one on your chest. That tells us you're breathing deeply, not shallowly. If you took a blood pressure reading earlier, keep it in mind. We'll come back to it shortly. Now, gently empty your lungs by breathing out through your mouth. Good. Close your mouth and breathe in through your nose for 4 seconds. Now gently hold your breath for 7 seconds. Then slowly breathe out through your mouth for 8 seconds, as if you're softly fogging a mirror. That's 1 cycle. Let's do it again together. Inhale through your nose for 4. Hold for 7. Slowly exhale through your mouth for 8. Notice how your shoulders begin to relax. Your jaw softens. Your heartbeat starts to feel slower and steadier. Let's complete 2 more cycles at this same pace. With each slow exhale, imagine tension leaving your body. There's no force here. No strain. Just steady, controlled breathing. After 4 total cycles, most people notice a clear sense of calm. Many also see their blood pressure drop by several points almost immediately. This technique is especially helpful when you feel stressed or overwhelmed. When your blood pressure spikes unexpectedly before bed, to calm your body for sleep. For best results, practice this breathing pattern 4 times per day, even when you feel fine. Think of it as training your nervous system to stay calm more easily. Just 2 minutes per session can make a meaningful difference over time. In the next part, I'll show you an even simpler breathing method, one you can do anywhere, without anyone noticing, that helps stabilize blood pressure long term. Technique 2. The steady breath that trains your body to stay calm. Now that you've experienced how controlled breathing can calm your system quickly, I want to introduce a second technique. This one is even simpler, but don't let its simplicity fool you. When practiced consistently, it can retrain your nervous system and lower your average blood pressure over time. This method is called steady rhythmic breathing. There's no breath holding. No complex counting. Just a smooth, even rhythm that brings your heart, lungs, and blood vessels back into balance. Here's why this matters. Your heart rate naturally rises when you breathe in and falls when you breathe out. When breathing becomes slow and rhythmic, this natural pattern becomes more efficient. The heart doesn't have to work as hard. Blood flows more smoothly. Pressure inside the arteries decreases. Research has shown that breathing at a steady pace of about 6 breaths per minute is ideal for calming the cardiovascular system. At this pace, your nervous system enters a state of balance, neither stressed nor sluggish, just steady and controlled. I've used this technique with patients who experienced anxiety-related blood pressure spikes, especially during doctor visits or stressful situations. Many of them had normal readings at home but very high numbers in clinical settings. Once they learned this breathing pattern, their readings stabilized, sometimes dramatically. Now, let's practice together. Sit comfortably, just as before. Place one hand on your abdomen so you can feel your breath moving. This time, you'll breathe in for 5 seconds, and then breathe out for 5 seconds. No holding in between. Just smooth, continuous breathing. Let's begin. Slowly breathe in through your nose for 5 seconds. Now gently breathe out through your nose for 5 seconds. Again. Inhale, slow and steady. Exhale, smooth and relaxed. As you continue, notice how your breathing feels effortless. There's no pushing. No strain. If 5 seconds feels too long at first, that's okay. The goal is comfort, not perfection. Let's continue for a few more cycles. With each breath, your body receives the message that it doesn't need to stay on high alert. Stress hormones begin to drop. Blood vessels soften. Pressure starts to ease. This technique is incredibly discreet. You can do it while sitting in a waiting room, while watching television, while lying in bed, even while riding in a car as a passenger. No one around you will know you're doing it. For best results, practice this technique for 5 to 10 minutes, once or twice a day. Many people prefer morning and evening. Over time, this steady breathing helps lower baseline blood pressure, not just during stress, but throughout the day. Consistency is what makes this technique powerful. Think of it as daily maintenance for your nervous system. In the next part, I'll show you a breathing method designed specifically for sudden blood pressure spikes, anxiety, or moments when you feel out of control and need relief quickly. Technique 3. The emergency breath for sudden pressure spikes. The third breathing technique I want to teach you is the one I consider the most powerful in urgent situations. This is the technique to use when your blood pressure suddenly rises, your heart starts racing, or anxiety takes over and you feel like your body is spiraling out of control. This method is often called alternate nostril breathing. It has been used for centuries, and modern research now confirms what traditional practices understood long ago. This breathing pattern can rapidly calm the nervous system and lower blood pressure in a very short period of time. What makes this technique different is that it forces your breathing to slow down while also balancing both sides of your nervous system. It interrupts panic, reduces stress hormones, and restores control. I've taught this technique to people who experienced nighttime blood pressure spikes, sudden anxiety attacks, or stress-induced surges that previously sent them to the emergency room. In many cases, just a few minutes of proper breathing made a measurable difference. Now, let's go through it step by step. Sit comfortably with your spine upright. Relax your shoulders and jaw. Raise your right hand. Your thumb will be used to gently close your right nostril, and your ring finger will close your left nostril. Your index and middle fingers can rest lightly on your forehead or fold down, whatever feels comfortable. Here's the pattern. First, gently close your right nostril with your thumb. Breathe in slowly through your left nostril for 4 seconds. Now close your left nostril with your ring finger, release your thumb, and breathe out through your right nostril for 4 seconds. Next, breathe in through the right nostril for 4 seconds. Then close the right nostril again, open the left, and breathe out through the left nostril for 4 seconds. That completes one full cycle. Let's do this together again. Slow, controlled movements. No rushing. As you continue, notice how your breathing naturally becomes deeper. Your heart rate steadies. Your body begins to settle. Let's complete 2 more cycles at this same calm pace. Each cycle helps quiet the stress response. Blood vessels relax. Pressure inside them decreases. This technique is especially useful during sudden anxiety or panic, when blood pressure spikes unexpectedly at night, when your mind won't slow down, when you feel physically overwhelmed. Most people notice a clear calming effect within 3 to 5 minutes. Unlike the first 2 techniques, this one is not meant for constant daily use. Think of it as your rescue tool, something you use when you need fast relief. In the next part, I'll show you exactly how to combine all 3 techniques into a simple daily routine, so you know when to use each one for the best results. How to use these 3 breathing techniques together. Now that you know all 3 breathing techniques, the most important question becomes this: when should you use each one? Using the right technique at the right time makes all the difference. When combined correctly, these methods don't just lower blood pressure temporarily, they help reset your nervous system over time. Let me break this down in a very simple, practical way. Daily foundation breathing. The first technique, the slow breathing with the extended exhale, is best used as your daily foundation. This is the breathing pattern that trains your nervous system to stop overreacting. Use it first thing in the morning, before starting your day, midday, especially if stress builds up in the evening, to wind down. Before sleep, each session only needs about 2 minutes. For short sessions a day are far more effective than one long session done occasionally. This regular practice teaches your body that it doesn't need to stay tense all the time. Long-term stabilizing breathing. The second technique, the steady rhythmic breathing, is your maintenance practice. This one is about long-term control. Use it once or twice daily for 5 to 10 minutes at a time. Many people find this breathing especially helpful in the evening, when they want to calm both the body and the mind. Over weeks of consistent practice, this technique helps lower your average blood pressure, not just sudden spikes. Emergency relief breathing. The third technique, alternate nostril breathing, is your emergency option. Use it when your blood pressure suddenly spikes during anxiety or panic, when your heart is racing, when you feel out of control. 5 minutes is often enough to bring your body back into balance. This technique is not meant to replace medical care, but it can prevent stress from making a spike worse. Why this combination works. Each technique targets your nervous system in a slightly different way. Together, they create balance. One trains calm responses, one maintains stability, one provides rapid rescue. I've seen people reduce frequent blood pressure spikes simply by applying this structure consistently. In the next part, I'll share a real-world example of how combining these techniques led to significant blood pressure improvement, without adding more medication. At this point, you understand the techniques and how to use them. Now let's talk about what happens when someone actually commits to this breathing routine consistently. I want you to understand something very clearly: breathing techniques don't work because of belief or motivation. They work because they change how your nervous system functions. And when your nervous system changes, your blood pressure follows. I've seen this repeatedly. Many older adults start with readings that remain high despite medication. Their blood pressure might average in the 150s or higher, even while doing everything they're told. When breathing becomes part of their daily routine, something shifts. One individual I worked with was already taking multiple blood pressure medications. Stress caused frequent spikes, especially in the evening. Instead of immediately adding another medication, we focused on breathing consistency. Every morning and evening, this person practiced steady rhythmic breathing. During the day, the extended exhale technique was used whenever tension built up. And during moments of panic, alternate nostril breathing was applied. After several weeks, average readings dropped noticeably. Not just once, but consistently. Over time, the need for additional medication was postponed, and stress-related spikes became less frequent and less intense. What's important to understand is that these results didn't come from one perfect breathing session. They came from daily repetition. Your nervous system learns through repetition. The more often you send calming signals through slow breathing, the more your body begins to adopt that calm state as its default. This is why many people feel different after just a few minutes, but experience lasting changes after a few weeks. Breathing practices also improve awareness. People begin to recognize early signs of stress before blood pressure spikes. That awareness alone can prevent many episodes from escalating. This doesn't mean medication becomes unnecessary. But it often means medication works better, and sometimes at lower doses, when the nervous system is no longer constantly overstimulated. The key lesson here is consistency. 5 to 15 minutes a day can create meaningful change. Skipping days, rushing through sessions, or only practicing when things feel bad reduces the benefit. In the next part, I'll walk you through a simple step-by-step action plan you can follow starting today. No guesswork, no confusion. Now let's turn everything you've learned into a clear action plan you can actually follow. This is where knowledge becomes results. You don't need to do everything perfectly. You just need to do it consistently. Step 1. Establish your baseline if you haven't already. Check your blood pressure when you're calm and seated. Write the numbers down. This is your reference point. Tracking progress matters because it shows you what's working. Step 2. Choose your starting technique if you're new to breathing exercises. Begin with the steady rhythmic breathing. It's gentle, easy, and very effective. If you're feeling stressed or tense right now, use the extended exhale breathing. If your pressure spikes suddenly or anxiety feels overwhelming, go straight to alternate nostril breathing. Step 3. Practice for 5 minutes today. Set a timer. Remove distractions. Focus only on your breath. This short practice immediately signals your nervous system to calm down. Many people see a small but noticeable blood pressure drop even after one session. Step 4. Recheck your blood pressure. After your breathing session, wait a minute and check your pressure again. Compare it to your baseline. This feedback reinforces that your actions matter. Step 5. Build a daily habit. Commit to at least morning breathing, evening breathing. Think of it like brushing your teeth. Non-negotiable. Short, simple, and effective. Step 6. Track weekly averages. Don't obsess over individual readings. Look at trends over 1 to 2 weeks. Most people begin seeing improvement within this time frame. Step 7. Involve your doctor. Share your blood pressure log. Never stop or change medication on your own, but many doctors are supportive when they see documented improvement. In the next part, I'll cover important safety guidelines and who should approach breathing exercises more carefully. Before we finish, it's important to talk about safety. Breathing techniques are natural and generally very safe, but they still need to be used wisely. First, understand this clearly. These breathing methods are designed to support your health, not replace medical care. If you have high blood pressure, medications may still be necessary, and you should never stop or adjust them without your doctor's guidance. That said, for most people, these techniques are extremely safe when done gently and without forcing the breath. Here are a few important guidelines. Go slow and stay comfortable. Breathing should never feel strained or uncomfortable. If at any point you feel dizzy, lightheaded, or short of breath, simply slow down or return to normal breathing. Your body responds best to calm, relaxed movements. Don't force the counts. The counting is a guide, not a test. If 4 or 5 seconds feels too long, shorten it slightly. Over time, your breathing will naturally become slower and deeper. Special health conditions. If you have severe lung disease, advanced heart conditions, or breathing disorders, talk with your doctor before beginning regular breathing exercises. Most people can still practice safely, but individual guidance matters. High blood pressure emergencies. If your blood pressure readings are extremely high or accompanied by symptoms like chest pain, severe headache, vision changes, or shortness of breath, seek medical attention immediately. Breathing techniques are helpful, but they are not emergency medical treatment. Why these techniques are still powerful when practiced correctly: slow breathing lowers stress hormones, slows heart rate. Relaxes blood vessels, improves oxygen delivery, helps reset your nervous system over time. This creates a calmer baseline state, making blood pressure easier to control. In the final part, I'll summarize everything you've learned and leave you with a clear takeaway you can remember and use daily. Let's bring everything together. High blood pressure often feels like something that happens to you, something you have little control over. But what you've learned today proves that isn't entirely true. Your body has built-in systems designed to calm, regulate, and protect your heart. Breathing is one of the most direct ways to access those systems. When you breathe slowly and intentionally, you're not just relaxing, you're sending a powerful signal to your nervous system. That signal tells your blood vessels to loosen, your heart to slow down, and your stress response to stand down. You now have 3 tools you can use anytime: 1 to train calm responses daily, 1 to maintain long-term balance, 1 to handle sudden spikes in anxiety. These tools are always with you. They cost nothing. They don't require appointments or prescriptions. And when used consistently, they can make a real difference. The key is commitment, not perfection. 5 to 15 minutes a day is enough to start changing how your nervous system behaves. Over time, this calmer state becomes your new normal. Blood pressure becomes easier to manage. Stress has less power over your body. Always remember, breathing techniques work best when they complement medical treatment, not replace it. Use them wisely, track your progress, and involve your healthcare provider in the process. If you found this video helpful, share it with someone who struggles with high blood pressure or stress. These techniques are too valuable to keep to yourself. Thank you for practicing with me today. Thank you for taking an active role in your health. And if you want more practical, science-backed strategies you can actually use in daily life, make sure to subscribe. And turn on notifications so you don't miss future videos from this channel. I'll see you in the next one.